Good morning, everyone, and for those who I haven't seen yet, certainly Happy New Year. I, like all of you, am very happy to have closed the book on 2020, and I look forward to 2021 with a lot of enthusiasm based on the hard work of British Columbians over the past 10 months. We know that light is there at the end of the tunnel. We know that vaccines are coming online. As of yesterday, 63,430 British Columbians have received a COVID-19 vaccine. And as we receive more stock from the federal government, more vaccines will be administered. We've been working hard to make sure that everyone in British Columbia understands the trajectory and how we're going to proceed going forward. But I think before next week, when Minister Dix and I and Dr. Henry will give a more comprehensive update on the vaccine strategy, I think it's important for British Columbians to understand, as a rule of thumb, our primary focus has been and will be, in the short term, making sure that the most vulnerable in our society are at the front of the queue. That's been working effectively to this point in time, and we're hopeful that in the not too distant future, all long-term care residents and staff will be vaccinated, which will stop the outbreaks and stop the spread of the virus in those locations. Acute care will take a little bit more time, but again, Minister Dix and I will be talking about that next week. I wanted to just give you an update today on what the government's been doing in 2021. Of course, last week I participated in a First Minister's meeting with the Prime Minister and other provinces to talk about the rollout of vaccines, to talk about the spike in cases in other parts of Canada, particularly Ontario and Quebec. We have seen a decline in cases here in BC over the past number of weeks, and I want to thank British Columbians for their patience and their resolve to make sure that we can continue to do our level best to battle this vaccine in our own, or battle this virus in our own way, in our own communities. But we have a lot more work to do, and Cabinet has been focused on that over the past 2 days, starting on Tuesday and Wednesday, with full Cabinet discussions on a range of issues with respect to economic recovery, addressing the pandemic, and of course then looking forward to the challenges and hopes and aspirations of British Columbians beyond 2021 into the next 4 years. And to that end, today we'll be starting a 2-day virtual Cabinet retreat. I'm here at the Legislature. We'll be having members of Cabinet in their communities across BC. We'll be engaging in that strategic planning process to make sure that, of course, first and foremost, we're focusing on the pandemic and economic recovery, but also all of the other challenges British Columbians are well aware of. We need to continue to work with partners, particularly the federal government, to get a handle on the other public health emergency here in British Columbia, and that's the opioid crisis. That's the focus of new Minister Sheila Malcolmson. She came to Cabinet yesterday with a package of initiatives. We'll be moving those forward in the days ahead. Minister Eby has been tasked with addressing the housing crisis here in British Columbia, not just homelessness, which is fundamental and front of mind for all of us, but also making sure that the affordability focus that we had in the first term is front and center as we move into the second term. Also, we want to build on what has been an unprecedented expansion of childcare in British Columbia. That is an area where I think all British Columbians, regardless of where they live, regardless of their political perspective, understand and recognize that childcare is fundamental to our economic well-being, as well as the development of our children and getting them prepared for the K-12 system and beyond as we build more skills into our communities, more skills into British Columbia. So with that, I'm sure there's many questions that you would have, but I wanted to say again at the outset that I'm very much looking forward to 2021. I think British Columbia stands very well positioned to take off as we put the pandemic behind us in the months ahead and start focusing on getting back to a place where we can enjoy the splendor and bounty of British Columbia and ensure that we address those fundamental challenges that have been here for a long time, like inequality, like making sure that all British Columbians benefit from the economic prosperity that we want for ourselves and for our neighbors and for our province. So with that, I'm happy to take some questions.
Reminder to reporters on the line, please press *1 to enter the queue. We're limited to 1 question and 1 follow-up today, and we're going to start with a question from Binder Sajan, CTV.
Hi, Premier. Just wanted to ask you about an emergency room doctor who's saying that over the last couple of weeks, a number of the people coming to clinic in Whistler were from out of province. That raised concerns in that community about the ability to support people's needs there, and she wondered if a travel ban is something that could be done. I know a few weeks ago you spoke about that you were going to have a conversation with other premiers. Just wondering how that went and if there are other more stricter measures that maybe could be put in place for Whistler.
Well, thank you for the question. And it's not just Whistler, it's all of British Columbia. We have open borders within Canada. Of course, we were first in line back in March to call on the federal government to close our international borders, and I think we've all benefited from that. We do have challenges, though, when it comes to mobility within Canada. We're getting further legal advice on that. We'll be talking about it actually later today or tomorrow as part of the retreat that I referred to in my opening remarks. But to the ER doc and to other British Columbians, I agree with you that on the surface, it would seem an easy thing to do to just tell people not to come here. That's not part and parcel of who we are as Canadians. Other premiers have expressed a similar view. We want to make sure people stay home, stay in place until we get through this. That's been my call. That's been the call of Dr. Henry and Minister Dix for some time now. And I've appealed to other provincial leaders to make the same case, and they're doing that. But despite that, British Columbians, Canadians are free to travel within the borders of Canada. The exception would be the bubble zone that was put in place in the Maritimes. And I just want to say, for context, the Maritimes population is not as large as that of British Columbia. So there's only a few ways in and out, and that's easier to manage than it would be here in BC. And so again, we're looking at some legal advice later this week, and I'll have more to say on that, Binder, probably early next week.
Binder, do you have a follow-up?
I do. Premier, just wanted to ask you about the recovery benefit. The website was overloaded. People were surprised that they had to send in a number of documents. Now we are hearing of delays in payments. Do you feel, given all these issues with the payment, that you've fulfilled your campaign promise of getting this money into the hands of British Columbians as quickly as possible?
Well, yes, I do. There's always room for improvement, but as I understand it, 1.4 million British Columbians have been approved. $645 million has already left the Treasury and is in the bank accounts of British Columbians. We heard obviously some challenges at the front end, and I was mindful of that in year-end interviews with you and others. But I came back in early January to a pile of messages from people around BC, grateful that they had applied on a Friday and on a Wednesday there was money in their bank account. That's not the story for everyone, but that's the story of the overwhelming number of British Columbians. And I'm grateful to the public service, the professional public service, who worked extraordinarily hard to make sure that we could deliver the resources that were committed. And we've got the program open until June of this year. So there's plenty of time to ensure that if people are being frustrated by the process, that we can work with them and get through that. I'm very proud of the work that the public service has done, and I know that many British Columbians, based on the volume of mail that I've received, are grateful to have the resources. Personal story, my spouse was shopping in Langford, and as she was going through the checkout, she's familiar to people in the community, of course, and the checkout attendant told her that their $1,000 had arrived just in time because their hot water heater gave up the day before. So that $1,000 went towards hiring a plumber, went towards getting a new hot water heater for that family. That was a found money for them, and that was very important to their lives. And I believe that story is duplicated right across BC. Could we have done better? Of course we could, but I'm confident that the vast majority of British Columbians, at least 1.4 million of them, are pretty happy with the way the program rolled out.
Our next question is from Rob Shaw, Check News.
Hey, Premier. Wanted to talk about the speculation tax for a second. There were some numbers that your government put out showing that, I guess on the one hand, foreign owners of vacant properties have dropped significantly in the first couple of years. And then on the other hand, the largest group now paying the speculation tax are British Columbians with second homes. And I wondered if you could talk about whether that's the version of the tax that you want to see going forward, and if you plan on making any changes there.
Well, as you know, Rob, 99% of British Columbians do not pay the speculation tax. In fact, it's less than a percentage that do. And they can avoid that tax, as offshore buyers or owners have demonstrated, by either moving the property and having someone live in it, or renting it out. And so this is an avoidable tax. This is something, if you don't want to pay it, there are mechanisms in the marketplace then you could avail yourself of. You can sell the property to someone who wants to live in it, or you can rent it out to someone who's looking for a place to live. I believe that the overwhelming number of British Columbians that support this tax, because it does not affect them and it addressed what was at the time a critically important issue. Overwhelming numbers of vacant properties and offshore investments that were driving up the costs for British Columbians. Those were our objectives. It was not designed to be a revenue driver. It was designed to be a housing initiative, and I think it's been successful.
Rob, do you have a follow-up?
Sure. Can I go back to the comment you made earlier about looking for legal advice on the inter-provincial travel issue? Could you just expand on that and sort of indicate what your goal in getting that advice might be? Is it your hope that you can work with the other premiers to restrict inter-provincial travel in some way, or put in some type of travel ban, or what is your hope there?
Well, I hear from, not just from the media, but from British Columbians, that they're concerned about people coming from elsewhere when they're making sacrifices of their own. We saw a whole slew of stories after the Christmas break about politicians who chose to travel, not from British Columbia, or not from, certainly from the Legislative Assembly, but right across the country. And that led to a firestorm of frustration and anger, because Canadians and British Columbians are making sacrifices. And one of those sacrifices is staying close to home, not traveling to see loved ones, not going to tend to what would have been traditions or pressing matters, the loss of life of a loved one in another part of the country. So it's been clear that this is a public interest, and we have been trying our best to find a way to meet that objective of the public in a way that's consistent with the Charter and other fundamental rights here in Canada. And so legal advice is what we've sought, and we'll take a look at it over the next couple of days. And if there is, I want to, I guess, to answer your question directly, Rob, I want to put this either to rest so that British Columbians understand that we cannot do that, and we're not going to do that, or there is a way to do it, and we're going to work with other provinces to achieve it. But people have been talking about it for months and months, as you know, and I think it's time we put it to bed finally and said either we can do it, and this is how we would do it, or we can't, and this is the reason why. That's the objective over the next couple of days.
Our next question is from Jack Knox, Times Colonist.
Hey, Jack. Happy New Year.
Okay, this is somewhat related. Should non-essential international travel be not just discouraged, but banned outright?
Well, we have made it as clear as we possibly can to British Columbians that they should stay here. And if they do leave Canada, they will be subjected to quarantine upon return. But again, Jack, I think that we've tried our best to appeal to people's common sense, their understanding, and their commitment to their community by making sacrifices about, for example, non-essential international travel. And those are individual choices at the end of the day. There is no prohibition in terms of a legal requirement, but there is, I believe, a moral obligation that British Columbians have to work with each other. Your neighbors are making sacrifices. You should be as willing as they are to make those sacrifices as well. But I don't know how we can direct people to not travel. If they choose to do that, they will have to live by the requirements of quarantine on the return. And that's the system we have in place today to protect British Columbians and Canadians. And I'm confident that it's working as effectively as it can.
Jack, do you have a follow-up?
Nope, that's good.
Our next question then is from Richard Zisman, Global.
I know you mentioned the vaccine rollout in your introduction, and I couldn't hear all of it, but I do want to ask specifically around this issue of queue jumpers. Does it frustrate you to see that people are jumping their spots in line, albeit a small portion of people? Is it frustrating to see that? And what can you do to assure British Columbians that as we move into April and we start having mass vaccinations and a lot more people getting it each day, but a lot more people waiting, that there won't be people manipulating the system to get the vaccine earlier than they should?
Well, I can't say today, Richard, what will happen with individuals in April. I can say that the examples that have been raised of queue jumping here in British Columbia cause me significant concern. There are two components of this, of course, as you know. I think Dr. Henry has been pretty clear on that. We don't want to waste a drop of vaccine. So if people do not come to their appointments, if there are other healthcare providers or other people close at hand that we can immunize, that's happening. Those that deliberately jump ahead of others who are a higher priority, that's profoundly disappointing. And we're going to work as hard as we can to avoid that, not just in the next number of days, but in the months ahead. But when we do get, and Adrian and I and Dr. Henry will be talking about this next week, when we get to the place where we're doing the mass vaccinations, hopefully we're looking at 500,000 a week when we get to full operation. And of course, again, we're relying on the federal government to do its best to make sure that we have product here. That scarcity is still a challenge. And again, I'm not throwing any rocks here. It's just something I think all Canadians understand. There are 7 billion people anxious to get a vaccine, and there aren't 7 billion vaccines. So we need to make sure we prioritize the distribution. I think that the overwhelming number of British Columbians will understand that waiting their turn in terms of what is the best health outcome. We want to start, I think the rule of thumb is the older you are, the more at risk you are. There are comorbidities, a host of other issues. Aside from getting a pile of mail about people grateful for the COVID benefit, I also got a pile of mail from various organizations, all with legitimate concerns about their workforce and suggesting that they should be prioritized over another group of people in society. So these are difficult issues. Everyone has a good case to make. I don't need to inventory them. I'm sure there will be a raft of stories between now and the last drop of vaccine distributed about who should go where in the lineup. I want the public to know that we're going to make sure we do our best to prioritize those who are at the greatest risk. And our understanding at this point in time is the older you are, the more at risk you are. So that's how we're going to prioritize going forward.
Richard, do you have a follow-up?
I do. In November, you said that we are the most transparent jurisdiction in North America when it comes to releasing COVID-19 data. Since then, we've heard a lot of concerns about specific areas where we are not releasing data. A letter was sent to you from the opposition today, or earlier this week, asking, or actually to Minister Dix, asking for more transparency. I want to ask specifically about the transparency when it comes to schools. Do you believe we are doing enough to inform parents around the issues of COVID in schools? And should we not be providing specific information around teachers, students, and spread in classrooms like we're seeing in Ontario and other jurisdictions?
Well, again, we have done our best to make sure that we have a school-by-school, district-by-district approach to the K-12 system. There's been successes, overwhelming successes in many parts of the province and some challenges in others. In terms of transparency and distribution of information to the public, we have done the best we can to make sure that those that need to know do know. But creating hysteria when there may not be a prospect of transmission is what we want to avoid. And we also want to protect people's privacy. We do not want people stigmatized. This is, I think, a good opportunity for me to raise the example here very close to my community, an area that I used to represent in the legislature, the Cowichan tribes, who are being treated absolutely appallingly by community members because they have been identified as potential COVID patients. That's not what anybody wants. But if you're starting to point to individuals and saying they have COVID-19, that stigmatizes individuals, it stigmatizes children in some cases. We want to make sure that people who need the information get it, and we've been doing our best to ensure that that happens. I look at other jurisdictions, and the case count numbers would tell us that whatever they're doing is not as effective as what we're doing. The distribution of information is guided by legislation in many cases, and also good public health practices. And I'll continue to take my advice and counsel from public health authorities on how best to distribute that information.
Our next question is from Vaughn Palmer, Vancouver Sun.
Good day, Premier. There was a photograph out of Prince George this week that showed two massive sections of turbine huge things being moved along the highway and destined for the Site C hydroelectric project in the northeast. Given that they're still shipping components of that size to Site C, is it not very unlikely that the government will be putting that project on hold after a careful reading of the Milburn report, which I assume by now you've read?
Well, Vaughn, there's a lot of work to do yet. Mr. Milburn did not have the capacity to address the safety challenges that could emerge as a result of geotechnical issues that arisen since we formed government, or certainly come to the attention of Hydro and to the public since we formed government in 2017, and the decision to proceed with, continue with the project started by the Liberals back in the early part of the decade. So we want to make sure we get those two reports. They're outstanding. We're hoping that they're going to be back. These are international experts, two of them. They'll be, again, also made obviously public when we have them and Cabinet's had an opportunity to digest them. There's a couple of decision points ahead for us within Cabinet before we release information to the public. We want to make sure we have all of the details. We do not want to be at half measure at a critical point in a large project, a large industrial project that is well advanced, as you know. But to stop preparing to complete is not the direction that's been given. And so it's appropriate, I think, that that those that are working on the facility continue to do that until such time as we don't. And I'll also tell you, you've been around long enough, and I'm not I'm not poking you when I say that, because I was around then too. But the Camano completion project also had turbines that were on their way, and that project was stopped. So it's not unprecedented. It's a good example for you to use, but we are still reviewing information, and most importantly, what's outstanding at this point is two safety reports, and when we have those and they've been assessed and digested, that'll all be made public.
Do you have a follow-up on?
Yes, please. I appreciate the clarification, Premier, because I did see the Energy Minister, Bruce Ralston, saying that he had received the Milburn report and he found it helpful. I just want to be clear what you're telling me, that this geotechnical problem which Hydro discovered over a year ago, either Milburn did not address how to fix it, or you're still waiting for two more reports. From whom, please, that will make it clear whether that problem can be fixed?
Well, it's just that, Vaughn. Milburn worked with the information that was available to him, the fix that's been proposed by Hydro, and we're now asking for two other opinions on the efficacy of that fix. I don't have the name of the contractors. They're outside of British Columbia, as far as I know, or certainly they're international experts in this area. This isn't to say that that Milburn's report isn't comprehensive, but it is also appropriate that we make sure that if the fix that is being proposed to the geotechnical challenge is going to be safe. And we want to, out of an abundance of caution, we're asking for a second and a third opinion on that.
Next question is from Lisa Yuzda, News 1130.
Good morning, Premier. Thanks, Jen. Regarding long-term care, BC did very well and were lauded for doing well in the first wave, but in the second wave, we've seen a quarter to a third of all active cases consistently over the past month being in long-term care homes. I'm wondering, do you need to do more as a government financially to support care workers being able to stay away when they're ill, or to bolster PPE and safety protocol refreshers, because Dr. Henry has mentioned this? I'm just wondering what your responsibility is as a government, if there's more you can do, because it's pretty devastating right now.
Well, one of the key components is going to be making sure there are more staff. If there is a positive test, that leads to disruption in the long-term care facility. That means that there are challenges in restaffing and making sure that those residents in the care homes are safe and getting the services that they need. So we need, first and foremost, we need to hire more people, and that was made clear before the election campaign, during the election campaign, and we are taking steps to increase the number of people working in the sector. That's the first thing we can do. In terms of other issues around long-term care, I know Dr. Henry and Minister Dix are focused like a laser on that. Isabel McKenzie is doing a review. I welcome that. I look forward to the information that she brings forward. But again, all of us, not just in British Columbia, but across the country, are wrestling with these issues. And asymptomatic staff may well be, we don't yet have a solution to that. And we're keeping a close eye on these issues, and we're trying to manage them to the best of our ability. And again, I don't like to, and this is probably the third time I've done it, so it doesn't sound like I don't like doing it, but I have to compare our successes in British Columbia to the United States and to other provinces, because that is where continental North America is where we need to address issues. And here in British Columbia, we're looking at best practices in other jurisdictions, and we are trendsetters in many other ways when it comes to addressing these challenges. So I'm confident and comfortable that the teams that we have in place are doing everything they can to restrict and reduce transmission, but we all have a responsibility. And again, I'm very proud of the sacrifices that British Columbians have been making, not just for a little while, but for a long, long time. And I appreciate the frustration, not just within long-term care, and of course the families who have loved ones in care facilities, and the courageous heroes that go to work every day in our healthcare system, despite the risk to themselves. I think we all just need to keep focused on that relative to other jurisdictions, British Columbians are doing extraordinary things every day, oftentimes going without reporting. So although there are certainly lots of examples of where we can make improvements, we'll continue to improve in those areas, but I think we often need to pause and celebrate those successes that we've been having as well.
Lisa, do you have a follow-up?
I do. Sorry, fumbling with my phone here. Regarding schools, you mentioned, saying with the information that's been that's being given out, that part of the issue is privacy. But I've talked to Dr. Bonnie Henry about this, and I've been following it very closely. And she's mentioned that one of the big challenges is the data system. That the way the data system is set up, it makes it very onerous and laborious, which I think is probably why we only got this data from Vancouver Coastal Health today, because, of course, we need public health working on the front lines. So is there not something that you can do as a government to improve this data health system or the data system from schools going into health, so that this information that does give confidence to parents that they don't have access to, even if more broadly, that is more accessible to public health so they can make it accessible to parents and staff?
Well, certainly new Minister Whiteside has been immersed in these issues from her swearing in back in November, and will continue to as we come through the pandemic in the months ahead. We're having all of the cabinet approach this with a focus. That's what the retreat that I referred to today and tomorrow will be all about. How can we take our collective energies and efforts to addressing the challenges British Columbians see, the gaps they see in our ability to fight this pandemic. But the highest priority British Columbians have is getting through this and making sure that we recover our economy in a way that makes sure that everybody benefits. And a lot of it, there's been a disproportionate impact of COVID on marginal populations, on women, on young people, people of color, and we want to make sure that when we restart that we're focusing on those issues. And in the K-12 system, again, I tip my cap to the thousands of teachers and the hundreds of thousands of kids and families who have put their faith in our K-12 system, and all of the stakeholders, teachers, administrators, education assistants, janitors, parents, everybody working as hard as they can to make sure kids are safe, because we all know that the best place for kids to be is in a classroom. And that's evident by the glee on the faces of youngsters when they see their friends. And again, many people may have had bad experiences in their school years, but if you don't have to spend too much time thinking about those happy times when you were in the K-12 system, and we don't want to rob this generation of those experiences. We want to make sure that we're doing this as safely as we can. The distribution of information is at this point as effective as it can be, but that doesn't say we can't improve upon it. And Minister Whiteside is working with public health, working with trustees and school boards to make sure that we're giving as much information as we possibly can to give people confidence that their kids are going to be safe.
Our next question is from Prabjot Sohal, Red FM.
Good morning, Premier. My question to you is that recently there has been a spurt in the Lower Mainland gang conflict. In the last 14 days, at least 5 people have been killed, including a 14-year-old. What is the government doing about it? What is the strategy to prevent and control such events in the future?
Yeah, the uptick in gang violence in the Lower Mainland is very troubling for all British Columbians. And I know Minister Farnworth, the Solicitor General, has been working on this since we were sworn in back in 2017, and there's more work to do. But again, I appeal to the community. If you have information that can help with enforcement, if you have information that can help law enforcement and government address these issues, you need to come forward anonymously to give that information. The way we curb this is by having the community rise up and saying, this is not acceptable. We've had enough of this. We need to curb it. We need to crush it. We need to stamp it out. But to do that, we need people who have information to bring that information forward so law enforcement can do their work.
Prabjot, do you have a follow-up?
Yes. Is there a specific plan regarding the policing and any strategy change that the government is thinking in the future?
Well, we've worked on a whole range of issues within schools, for example, to stop the stream of young people going to the gang lifestyle rather than taking a more healthy and helpful approach to their well-being long-term. That means making sure that our schools are open. That means making sure that teachers and counselors and others in the school system have the tools they need to identify and detect challenges with young people and trying to get them back on the right track. If we stem the flood of people going into the gang lifestyle, that's another way to stamp it out. So those programs have been developed over time. Before we arrived, we've accelerated some of them, and we'll continue to add to those programs because I believe community education and an understanding that collectively we're all in this together is a key component of success here. And so we're going to be advancing those issues as well as the stuff behind the scenes that law enforcement and the Solicitor General are working on. Those are issues that are better answered by him. But I'm confident that British Columbians want to see an end to this. We have to stand up and do it together.
We have time for one more question today, and that will come from Eva Eugene, CBC.
Hi, Premier Horgan. As was mentioned, the province is dealing with dozens of outbreaks at long-term care facilities. Health authorities have said most of these were introduced by staff who unknowingly brought COVID-19 into the facilities, often not recognizing symptoms of fatigue or illness. We've heard the facilities are understaffed, making it difficult to implement safety protocols effectively. And also we know that many care aides cannot earn a livable wage and are working in multiple places to supplement their income. You mentioned needing to hire nearly 12 months since the pandemic began. Why is this taking so long when we knew the second wave was coming? And will frontline workers be getting pandemic pay during this second wave that is even more challenging than the first?
Well, thank you very much for the question. And again, you've sort of answered the question in presenting it. The challenges we have is that asymptomatic workers are not clear that they're sick. Many attribute their fatigue to just that, being overworked, because we need to have more people in the sector. So these are challenges that human failings, that being not being able to identify that you're sick. We've been pretty clear from the beginning, if you're not well, stay home. That has consequences in the long-term care sector because we don't have enough people. And that's why we made that a high priority and continue to make it a priority to hire more people. People are coming on stream. We need there's training that's required. You can't just walk in one day and say, how can I help? Although the volunteer sector has been curtailed as well because of COVID, but we're doing our best to make sure we're putting resources in place to protect residents of long-term care and, of course, to keep the staff safe and supported by more people around them.
Do you have a follow-up, Eva?
I do. 2/3 of our COVID fatalities, as we know, have been in among seniors in long-term care, over 600 people. The seniors advocate has said she will be investigating all care homes to discover what went wrong at the ones that experienced the major fatal outbreaks like Little Mountain Place, Tabor Village, Lynn Valley, and Langley Lodge. While you mentioned that BC has fared better than other jurisdictions, that's little comfort to families that have lost loved ones and seniors that have been confined to their rooms for months, and this has been a traumatizing experience for many of them. I'd like to know if your government will commit to launching a long-term care commission to look into how and why COVID-19 spread in these long-term care homes and the impact of this on the existing system as was done in Ontario.
Well, our focus right now is to make sure we're keeping people safe. I welcome Isabel McKenzie's interventions here in the cases that you've outlined, and I look forward to the recommendations she brings forward. I think it's premature at this time to talk about commissions. I think we need to focus on vaccinations. I think we need to focus on making sure we're building new long-term care facilities to do away with 4-person rooms, to build a modern long-term care structure that will meet the next generation's needs. That's our priority today, and we'll be informed by the work of Ms. McKenzie and others to get us there. But at this point, I'll await the next number of months and advice and recommendations from Minister Dix and public health officials, as well as the health authorities and the operators of the facilities, who will give us a better understanding of where we need to go. But I think it's premature for me to say today that that's the direction we're going to go.
Thanks, everyone. That's all the time we have.